I'll start off by saying that the numbers, as we have said, each one of these briefings continue to go up, but the rate of increase has certainly slowed down, at least recently. So just as a citizen, in addition to a county executive, I want to thank every single member of the community who is sticking with social distancing, because it's making a difference, and you can see it. You are bending down the curve, and it's making a difference. So we need to keep that up. Second, as we know now, and I reported last night, we had an election, and we have a new county executive. I've spoke to David, County Executive-elect Crowley, a bit about some of the things that are going on at the county, and obviously we'll work with him to try and ensure that he has, it's really nice, a better administration than I did, but relevant here. He is committed, as I am, and everybody involved, to continuity, particularly with the county's work with the Emergency Operations Center, and in general, our COVID response and the resilience and growth that's going to be needed coming out of that going forward. I'm confident he's going to do a great job, and looking forward to working with him. And in the meantime, as you've heard us say often, the work that we're doing during the day, a lot of it involves, especially now, ensuring that the state, the city, the county, that we all get as much of the resources and support that are coming out of the federal government as we can, because we're going to need them. So I've spent a lot of time on the phone with our friends and in the delegation in Washington, congressional delegation, and that will continue. I'm sure the mayor has as well, and coordinating that with the state. If we do this right, we're never going to have to use the surge facility. We're going to get great funding for the city, for the county, and for the state, because we're going to need it for what comes next, which is, the process of economic recovery. But in general, I'm cautiously optimistic about what is a visible, at least recent, flattening in the statistics. I'll just remind people, though, we have to maintain the distancing, and we have yet to see if there's going to be a bump to the election. With that, I'll pass it on to the mayor.
Well, thank you, Mr. County Executive. And just as the County Executive looks at these figures every day, I look at these figures every day, twice a day, because we have the 7:30 and we have the 2:30 update. And for 5 consecutive days, we saw the number of cases decrease, and that obviously gave us all optimism. But the numbers that just came out within the last half hour showed an increase of 56 cases from where we were 2 days ago to yesterday. And we're now at approximately 560 cases, more than we had just a week ago. And a week ago, of course, was Election Day. So in the week since Election Day, we've had 560 additional cases. We've had 42 additional deaths since Election Day. So I don't think anybody is pretending that we are out of the woods yet. We know that we've made progress, and we're happy with the progress we've made. But I don't think anybody can be lulled into a false sense of security, because, as the county executive said, I think a lot of what has occurred is a result of the social distancing that many of us, and hopefully all of us, are implementing in our daily lives. Not something that I think most of us want to do, but it's something that is so necessary. And I think we all share the sentiment. We would love to get our lives back to normal as quickly as we can. That's the goal, to get our lives back as quickly as we can to normal. But we know that there's a lot more work that needs to be done. At the city, with the allocation that we've received for our block grant dollars, we're working on an initiative that we'll have more details about in the next couple of days, utilizing our block grant structure, utilizing Employ Milwaukee, trying to get some outreach into the neighborhoods where we need it the most. We have seen, obviously, the first outburst, if you will, it was in 53210. What we have seen subsequent to that are increases, pretty dramatic increases in zip codes 53209, also on the north side and 53215 on the south side. We know West Dallas has had a number of cases as well, and Wauwatosa has. Other suburbs have been hit, but those are the areas where we're seeing the increases. We still, as a county, make up a significant percentage of the cases in the state, and that's why I think it makes sense, as the county executive has said, for us to be fighting for resources, because it's having a public health impact, but it's also having an economic impact here. And that economic impact clearly is spread throughout the state of Wisconsin, but we know that we're experiencing it here as well. One other thing, when this all began, and I sat down with hospital leaders, there were three issues that really were paramount to me. One was testing. The second one was having a good coordination and cooperation and knowing exactly where we were in the number of hospital beds we have and how many we would need, the number of ventilators we have and would need, the number of ICU units we have and would need. And then the third factor was whether we would need to do an expansion, the alternative care facility that we're talking about. The second and third items, I think we've done a really good job. And when I say we, that's a really, really big umbrella. And the county has been phenomenal in working on this issue. The hospitals have been very, very good. The community health centers have been very, very good. And so now I feel very confident telling you that we have a very, very good read on how many hospital beds we have, how many hospital beds we're projecting to need. There are different models, so you have to adjust there. How many ventilators we have, how many we'll need. The same with ICU. So that's all very, very positive. The second part that's also positive, I think, is the work we're doing on the alternative care facility, which we've said many, many times, we hope is an empty building when we're done with this, but we would all be feeling terrible if we didn't build it and we needed it. So two of the three pillars of what I consider most important in moving forward, I feel very confident about right now. Again, knowing what the data is, because for the first week or so, I felt like we were flying in the dark. We didn't know what we were going to need. Dr. Weston and Dr. DeMoya and others who have worked on this have really brought the hospitals in with them, and we've got that. So that's really positive, as is the work that we've been doing. And the state really has stepped up in a very, very meaningful way to help both the county and the city, as well as the city of West Allis, to move that forward. It's the first part that is still, I think, what we need to really put some effort on. And when I say we, it's everybody. And that's the testing, the community testing, so that we can know exactly what we need to do to stem the spread of this. And when we talk about testing, we're still talking about symptomatic testing, that every health professional that I've talked to in the last several days has stressed that we're still talking about symptomatic testing. So we're not at the point where we're doing all of that, and we need to get beyond that, I think, for us really to contain this so we can get our economy going again. So again, a lot of people are doing a lot of work, and I'm very proud to see the cooperation that we are seeing throughout all of southeastern Wisconsin. So with that, I'll turn it over to Darren Rausch. Darren?
Thanks, Mayor Barrett. My name is Darren Rausch, and I'm the health officer for the City of Greenfield Health Department. It is my pleasure to join today as one of the representatives from our Milwaukee County Health Departments, and there are 11 of us in Milwaukee County. I just want to point out that public health officials continue to monitor the disease trends countywide, anticipating a formal peak of COVID-19 cases. Yesterday, the narrative was honing in on the fact that statewide and county COVID case counts were some of the lowest over the past month. Unfortunately, this just appears to be a blip or a one-day occurrence. Today, we saw the statewide numbers increase by 127 COVID cases, and the Milwaukee County cases increased by 90 COVID cases. So today's countywide data reflects 1,865 cases and 91 deaths. It's important to point out that we are aware of the current discrepancy in the statewide death data reported for Milwaukee County. The state is currently reporting a death total of 101 cases, and we're actively reaching out to understand the differences. We believe, through conversation with our medical examiner, that this discrepancy is due to death certificates being filed directly with the state and not locally here in Milwaukee County. We will continue to work with the ME's office and the State Registrar of Vital Records, and we'll report back to you tomorrow. We continue to monitor in public health COVID cases, hospitalizations, and deaths daily to identify the evidence of flattening the curve that would indicate if we're nearing our peak incidence. If there are any signs of hope in today's data, it's this, and the county executive highlighted it earlier. Our current rate of COVID-19 case count doubling is nearly 8.5 days. That means our counts in Milwaukee County are doubling approximately every 8.5 days in terms of cases. By comparison, in the first week and a half of the COVID-19 pandemic in the county, our case counts were doubling in less than 2 days. So we have seen some improvement, and that's very important to kind of keep in the back of our minds as a positive. Now, it's important to note that COVID-19 data will continue to fluctuate greatly due to laboratory testing capacity. Mayor Barrett spoke to this as well. We are aware that the Wisconsin Department of Health Services has been actively expanding testing capacity over the past week, and that enhanced testing guidance has been shared widely with clinicians throughout the state. The state indicates that current capacity can conduct nearly 4,000 tests per day across all of the laboratory systems, both large hospital labs, the State Lab of Hygiene, the Milwaukee Health Department lab, and others. However, we're currently not reaching our maximum capacity due to several reasons. That includes supply chain challenges that still exist, access to PPE for testing, which is quickly resolving, and some clinicians who may be following older guidance related to who is eligible for testing. Currently, according to the State Department of Health Services, there are no limitations for COVID testing of symptomatic individuals. But remember, there may be localized challenges as details about the testing process and supply chain logistics are worked out. Lastly, I want to mention that we are continuing to work with our healthcare system partners to increase that capacity daily within the county, and many of our health system partners and federally qualified health centers have been involved in those conversations. I want to mention that public health officials have significantly impacted the lives of the public throughout this pandemic. Without effective treatments or a vaccine, the primary method we've had to slow down the spread of COVID-19 is through interventions like the Safer at Home order. The State Department of Health Services has been widely touting the success of that Safer at Home order, and I want to continue to encourage all of you watching and all of the residents throughout Milwaukee County and the state to continue to do your part and stay safer at home. Safer at Home is working, and it is saving lives. Thank you.
Thank you very much, Director Roush. Next, we will hear from Milwaukee County Clerk and Executive Director of the Milwaukee County Elections Commission, George Christensen.
Thanks, Brian. First of all, I want to thank everyone last night for their patience and hard work. The election went smoothly for us. We had a live feed for the first time that we did through Facebook, and that was very well received and didn't have too many technical difficulties with that. So I plan on doing that in the future and trying to make some improvements on that. We also, as we always do, have a media room where the media and the public can come and view the results as they come in. We encouraged people to use the live feed. However, we did have quite a few people actually come down in person. And every one of them, I want to thank them for following our guidelines. We issued PPEs, a face mask. We gave them gloves if they needed them. And we asked them to stay 6 feet apart, and they did. And we really appreciate that for myself and for all the staff that were there. Speaking of staff, I want to, of course, thank Julietta Henry, the elections director, for an outstanding job again, and her staff for working so hard, and also recognize all the municipal clerks throughout the county who did such a wonderful job last night. As I mentioned, the election went well, went smoothly for us, and I just wanted to point out a couple numbers quickly. We had 41% turnout of total voters. That compares to 57% from 2016. So clearly you can see a decrease in voter turnout, and which has been caused obviously by this pandemic. So that's unfortunate, but that's just the facts, and those are the numbers. With that, I'll open up to questions, or if I have my elections director on the call, and she can always answer any additional questions.